Game changer. That's how one Louisville urologist describing a newly available prostate cancer treatment. Now he'll be first in the nation to perform the procedure right here in Louisville.
And the FDA only approved that procedure a few weeks ago, but it has been widely available in other countries for years. WHAS 11's Michaela McDonald shows us how it works.
This is the new weapon in a war against a disease that affects 1 in 7 fathers, brothers, and sons. It's a minimally invasive treatment for prostate cancer that uses ultrasound waves to target cancerous cells without harming other prostate functions.
So we're able to target the cancer very precisely.
Until a few weeks ago, you'd have to travel out of the country to have the procedure, but tomorrow, for the first time, it will be performed in the United States, here in Louisville by Dr. Jurige.
In certain patients who are found to have prostate cancer at an early stage, who are particularly motivated to preserve these quality of life issues, particularly the sexual functioning and the bladder control, we now have another weapon that we can use for these patients.
The procedure, called HIFU, which stands for high-intensity focal ultrasound, has been available in more than 40 countries for years, but only received FDA approval a few weeks ago. Dr. Jurige has performed roughly 400 HIFU procedures over the last 8 years outside the United States. One of his patients was WHAS 11's own Reed Yaden, who is speaking out for the first time publicly as a prostate cancer survivor.
Most people that know me are hearing this story for the first time. I've shared it with a couple of very close friends, but I wanted to wait to put a lot of distance there, and ideally till the procedure was FDA approved, to talk about it so I could look back and say, I had this 3 years ago. See, my life is perfectly normal and has been.
Reed had the procedure 3 years ago and says he was back to normal activity within hours and has experienced none of the side effects associated with more traditional treatment methods.
No cutting, all done with ultrasound.
Since having the procedure, Reed has been an advocate for HIFU, talking with men considering having it done. He's speaking out now to raise awareness for both the procedure and the importance of early detection.
I hope that it serves as an example of, you say, look, here's a person 3 years out. His life is normal. It disrupted my life minimally. Life goes on.
And Dr. Jurige pointed out that this approval comes during Movember, a month-long initiative to draw more attention to men's health issues. Both he and Reed encourage all men to get screened for prostate cancer. Michaela McDonald, WHAS 11 News.